Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and most of you know that primarily I treat pain conditions and joint problems. And so I just wanted to talk about something today called joint instability, and I really want to focus primarily on that today in the lower back or lumbar spine. And the reason I want to talk about it is because often, when someone has low back pain, they go, they get an x-ray and then they get an MRI. And those are good images, but they don't actually address joint instability or, talk about how ligaments can be more stretched or, lengthened and maybe not holding those bony structures together the way that they should be. And what we typically see on an MRI is, related to a tendon or a ligament is tendinitis. And we don't really see that with ligaments, but tendinitis we do see, or labral tears, capsular tears of the joint and that sort of thing, but not just ligament laxity. There's no measurement on an MRI to show that a ligament is not doing the job that it is supposed to do. And so the one that I really want to talk about today that I think gets widely under-discussed and undertreated is the iliolumbar ligament. And I'm going to show you a picture of that in just a minute. But that ligament, if you can imagine, L4, L5, and then the sacral base and your hips, that's kind of where that works. And then the iliolumbar ligament comes down and comes from the L4 and L5 vertebra and then comes down and attaches onto the iliac crest, which is your hip bone in your back. And that is like a major, if you could imagine, pillars that are holding up the walls of the house, that is what that ligament does. And you have one on either side. And if you have ever fallen really hard, or you have been in a car accident and you've braced yourself, or, wear and tear on the joint space, degenerative joint disease, degenerative disc disease, all of these things over time can cause a ligament laxity in that ligament itself. And when that happens, we start to see chronic low back pain and sciatica and all these different kind of chronic conditions of the low back that get treated in a lot of different ways, but don't actually target to restabilize the iliolumbar ligament. And that's what prolotherapy and PRP do. And so I'm just going to take a minute here to show you what the iliolumbar ligament looks like. And you can see here, this is your spine looking at you from the back, and that's L4 and then L5 there. And the iliolumbar ligament, it's a little bit hard to see, is this ligament here. And you can see, here's your sacral base. This is looking again at you from the back. And the sciatic nerve, I'll go back to that in just a second. Here we go. The sciatic nerve actually comes out from the bottom, from L4 and L5 there, and travels through and around over. And I can add that in just a second to show you. But do you see all that white tissue? Those are all ligaments and sacroiliac ligaments there. And when any of this gets injured, or there's chronic wear and tear from injuries or even from labor. I mean, many women have never healed completely from labor and don't even really know it. And they have all these kind of chronic low-grade issues that are not something they necessarily feel like they need to go to the doctor for, but it's all coming or stemming from a weak pelvic floor and injured sacroiliac ligaments, which are those ones I was just showing you on that video. And when that happens, that whole sacroiliac and then the lumbar spine, basically your low back and hips, that whole area can become so sort of like mobilized in a way where your muscles have to start tightening up in order to stabilize it. So basically what I'm saying is you have all these ligaments. It's deep tissue. It's fascia. They're almost like like the wrought iron that you see in concrete. They're major stabilizers. When trauma, arthritis, labor for women, men falling or chronic overuse, that could be women too. When those structures start to become unstable with age, then, or, weak core is another reason this could happen. The muscles start to need to stabilize that area, and they become tight. So tight muscles stabilize weak joints. And those are all joints that I just showed you. They're not really mobile joints. They're not like the shoulder or the elbow or the knee, like big joints, but they're big fibrous joints that actually shouldn't move a lot. They should shift a little bit, but they shouldn't be moving like a knee or a hip or a shoulder, like the most mobile joint in the human body. And so they don't get a lot of discussion. And so it's like, oh, well, you have a disc herniation, or you have DJD and arthritis, and there's nothing we can do about it. Let's just inject you until whenever, or put you on long-term pain management medication, which is again, in my opinion, not a solution. So what do you do about that? One, the thing you can do is, see a naturopathic doctor that practices like I do, PRP, prolotherapy, regenerative medicine doctor, basically, that looks at the whole versus just the one area of pain, and really looks at how all the systems are at play together, so that you get a proper diagnosis and treated correctly, and that you're not on a pain management path, that you're on, a curative path, or a much more effective long-term treatment path, if that makes sense. And so the other thing is PT, physical therapy, getting someone who knows about pelvic floor strength, core strength, and can really help you work through that process and figure out what's going, where is the imbalance in your body, and then going from there to restabilize, to help restabilize and remind the muscles that they can let go. You still have to do something to restabilize that joint, which is where prolotherapy and PRP come in. Prolotherapy is a high concentration dextrose therapy, meaning it's a very inflammatory injection that goes into the joint space and restabilizes those ligaments. And I'll go over what prolotherapy is and PRP are in other videos. I don't want to lose the point of this video. And then PRP is an even more regenerative substance, that's platelet-rich plasma. And we can go in there and restabilize all of these areas, which is incredible, because once we do that, the muscles relax. And when the muscles relax, piriformis syndrome, which is a tight muscle in your leg or in your glutes that the sciatic nerve often runs through. Why is it tightening up? Why are we calling it piriformis syndrome? It's tightening up because it feels like it needs to be tight so it can stabilize the sacroiliac joint, which is the joint between your sacrum and your ilium. And that's in that complex that I was just showing you, right? And there are massive ligaments in there. And so if they start to shift more than they should, what happens next? The muscles try to stabilize. That hurts. Tight muscles that don't allow your joints to move and be fluid the way that they're supposed to causes pain. And it's either going to be nerve pain or muscular pain, right? We don't often really talk about joint pain in that area because there isn't a lot for us to do there from a conventional medical standpoint. Except cortisone injections, which are just shutting off the fire alarm, right? A cortisone injection, all it does is shut down the messaging from the joint to your brain telling you that you're in pain. But all the pathology is still there, right? So you're still having tight muscles and issues with your joints and stuff, but it doesn't actually fix the problem. And that's where prolotherapy and PRP can come in there and actually fix the problem. And yeah, it can take more. It's not a one-hit wonder. You don't get one prolo injection and everything's fine, or one PRP injection and everything is fine. But multiple prolo or multiple PRP injections in that region can restabilize that entire area, as long as the patient is doing what they need to do, which I have gone through extensively in my foundational videos, which, I'll bring those up again as I move on, but more I'm trying to get into videos related to what actually needs to happen when you're trying to restabilize chronically, hypermobile joint, basically, is what it is. And so I just want the take-home messages to be, if you are suffering from low back pain, if you are suffering from sciatica, if you are suffering from pain in your hips, All of that is totally unnecessary, and there are other options out there for you to have treatment. And, the other thing I really encourage people to do and my patients to do is go through the screening process, because once that happens, it may come out that actually the pain is coming from something systemic, that either they're eating or an exercise that maybe they could be doing differently. That it could be coming from a hormonal imbalance, and a lot of pain layers come off when those systemic inflammatory issues have been taken care of, and then whatever is left over is treatable with prolotherapy and platelet-rich plasma injections. And so I just kind of wanted to really talk about that whole complex of the low back and pelvis, because there is so much to be done for that area that does not include cortisone injections, back surgery, which is a 50-50 chance. It's a coin flip, unless you have a severe disc herniation that you need to go in there and have that removed, then surgery can be very successful. But if it's for any other reason in your back, spinal fusion, any of those things, or taking discs out and fusing facets, those types of back surgery are it's a coin toss if you're going to get better from that or not, because it didn't address the pain generator, which was most likely the ligament laxity that's going on in that entire area, and that whole area needs to be treated with regenerative injection therapy. And so please, if you know anyone who suffers from chronic low back pain and is taking over-the-counter medication or anything like that, refer them to this video, because it may help them understand, where their pain is coming from, even to the point where they can describe that to their provider even better. And if you would like to see me, I would love to see you. Our phone number is 206-899-6000, and you can follow me on Instagram at Dr. Amber Nixon, and there is really great content there as well. If you like this video, please share and subscribe to my channel. Thank you.